Further debate. I recognize the member from Orléans.
Thank you very much, Madam Speaker, and I'll be sharing my time this afternoon with the member from Don Valley East. It's an honour to speak to Bill 135, the Convenient Care at Home Act today. When I first saw the bill being introduced, I thought to myself, finally, the government's going to do something about the state of home care in Ontario. But, Madam Speaker, I don't think this bill does what is needed. Most Ontarians, and certainly those that I speak to, would like to stay at home as long as possible as they age or as medical conditions arise. There's comfort at being at home, where you raised your family, where you live your life. As the scourge of illness or disease and the impacts of Father Time affect us, sometimes taking our dignity, it's essential to hold on to everything that we can, to maintain that sense of normalcy, to maintain our dignity as much as possible. Home care services are essential for those who may need assistance with their daily activities, bathing, dressing, eating, using the washroom, taking medications, amongst many other things. It should be and must be a top priority for our government to ensure that Ontarians can stay in their own home as long as possible and can do so with dignity and respect while receiving world-class health care. However, as a result of this government's underfunding of health care, home care services in Ontario are facing a crisis. They're underfunded, understaffed, and as our population ages, they are overburdened. The government has failed to address the issues head-on, including by imposing Bill 124, which continues to add to Ontario's health care retention issues. Now, Madam Speaker, I'd like to share the story of a constituent of mine, Martine. Martine is impacted by the chronic underfunding of home care services each and every day and is not being treated with the dignity and respect she deserves from this government. Now, here's Martine's story. Martine is an active 50-year-old. She's smart, articulate, and funny. She enjoys movies and concerts, good food, great company, and sometimes just a quiet night in. She has family life, friends, interests, and hobbies, just like the rest of us. She has much to contribute to her peers, her family, and the community at large. The only difference is that she is not able-bodied. Martine requires a wheelchair and help with daily living tasks. Throughout the day, Martine receives home care services from two separate home care agencies. But as a result of the continued underfunding, mismanagement, and lack of prioritization, Martine routinely goes without the home care services she needs, services she is entitled to, Madam Speaker. Martine needs help getting in and out of bed. Like any vibrant adult, she has an active social life. She enjoys going out with friends, hosting dinner parties, and all of the other social activities we take for granted. Routinely, Martine is told she needs to make a choice: continue to be a vibrant, active adult or receive home care. How is this choice given to Martine? By being told she can only receive service with help to bed at 8 o'clock, or sometimes as early as 5 o'clock in the afternoon. Imagine being told you have to go to bed at 8 o'clock every night and cannot get out of bed again the next morning until 7:30 or 8 o'clock. Imagine the indignity of being told that you cannot enjoy the same life we all enjoy because you're being put to bed early. Imagine what it would be like to have plans with friends and family and to get that last-minute call saying the PSW is no longer able to put you to bed when you get home. Or how you're going to go to work on time in the morning when the last-minute call comes in that morning saying there's no one to get you out of bed. Now, Madam Speaker, I look around the room. There are many amongst us with us at the moment who I would guess are 50 years old or perhaps a little bit older right now. How many of you can go 12 or 13 hours without using the washroom? That's what Martine faces routinely. Now, she is incredibly lucky. She has support from family and loved ones who, at the last minute, can drop everything to help her in these situations. But it shouldn't come to this. Not everyone has that support network. Martine and other Ontarians should have the confidence in our healthcare system to provide the care they need at home and to live healthy, and dignified lives. Now, I had the pleasure of meeting Martine at her home a few weeks ago, and I was amazed at the changes she's made to her home to adapt to her illness and how her illness will progress. As a result of her physical condition, every day is already a challenge, but she works hard to navigate life with a positive mentality. Madam Speaker, after spending some time with Martine, hearing her story, I don't think I could be that positive. Surely we need to help Martine maintain her dignity and live a productive and fruitful life, and that includes a social life. I wish I was able to explain to all of you, I wish she was here to be able to explain to all of you the things that she has had to go through and how she's had to adapt her life to this medical condition. But tragically, Madam Speaker, Martine's story and situation is not unique. Too many Ontarians who require home care services are in similar circumstances. And Bill 135 is nothing but a cosmetic change that will not address the root causes of the crisis in home care. It's putting lipstick on a pig, Madam Speaker. It doesn't provide a pathway for more funding to hire more PSWs and nurses. It won't improve conditions to help retain workers, the workers that we already have. It won't enhance accountability or transparency in the delivery of home care services or ensure public oversight. In fact, it creates a one-size-fits-all solution to a province that the Premier himself has said many times isn't a one-size-fits-all province. It doesn't make any sense. Bill 135 could make things worse by opening the door for more privatization and profiteering in the home care sector. We need a different vision for home care in Ontario, one that is based on ensuring dignity for our friends, our family, and our neighbours. Thank you, Madam Speaker.
Thank you. The member from Newmarket Aurora.
Thank you, Madam Speaker, and my question will be to the member from Orléans. So I have to tell you, my mind is a bit boggled right now. Under the previous Liberal government, you were cutting nurses. You were leaving our hospitals lacking in infrastructure, in disarray. There's 14 separate home care organizations. It's in fact the home care organizations that have been asking this government to make a change, to make it centralized. It's this government who's been investing $80 billion this year in this healthcare system. So I have to say, instead of navigating 14 separate home care organizations and waiting for a call at home, now this at-home program will be a one-stop shop that provides people with easy access.
Response? Member from Orléans.
Thank you, Madam Speaker. After 5 years of government, the government should actually take responsibility for the things the government is or is not doing. And one of those things is the provision of adequately funded home care. Now, the government member says that their administrative reorganization of home care will somehow make things easier. Well, I don't recall the administration reorganization of, how license plates are done making anything easier in Ontario, Madam Speaker, or frankly any of the other administrative changes this government has tried to make. I don't remember. In fact, I think we're seeing lots of problems with the administrative changes they made around the sale of cannabis in our communities, Madam Speaker. And so if they think administrative changes are going to provide more home care, they need to spend less time here at Queen's Park and more time out in their communities.
Thank you. Question, the member from London Fanshawe.
Thank you, Speaker. And this is something that's very important because our senior population is going to exponentially get bigger over the next 10 to 20 to 30 years, and home care is an essential piece. We know that when we speak to people who need care, their first preference, especially a senior, wants to remain at home. And under the Conservative government, home care used to be not-for-profit, and then Mike Harris' government changed all that and privatized it, and the Liberals, quite frankly, weren't any better. They continued that privatization. So I want to ask the member, would this member advocate and promote and actually make policy changes so that home care is not-for-profit and there's not a profit extrapolated out of caring for vulnerable seniors at home and many other people at home. Would you support
Question?
a not-for-profit policy in home care in this bill?
Thank you. Response?
Thanks very much, Madam Speaker. In fact, in the last election, we proposed a dramatic change to home care that would ensure that it was not-for-profit and based on a more community-centered and community-based model. So, of course, I think if there is government funding available, that funding should go to helping people directly by hiring PSWs, nurses, other support workers, the things that they need. If you have a profit center involved in that, obviously those people are skimming off the top and there's less money available to support people where they live. Thank you, Madam Speaker.